right, hello, we're going to get started. So when you think about what makes a strong revenue cycle, we think about the technology, the dashboards, the automation, but we also need to think about what makes everything the great story, and that is the people. The people make it all come to life. So that is why I am thrilled to welcome Rachel Dallmann, Chief Ancillary Officer at Phelps Memorial Health Center, to share with you how to build stronger teams and better revenue cycles. As Chief Ancillary Officer, Rachel leads and optimizes clinical operations while driving growth, accountability, and operational excellence at Phelps Memorial Health Center. She provides strategic oversight for directors and teams across many different departments, ensuring each area aligns with their mission of delivering exceptional patient care. So please welcome Rachel Dallmann.
Thank you. Thank you, Liz, for that warm introduction. I always like to disclose that I am a Chief Ancillary Officer, but I have, in the 18 years that I've been at Phelps, I spent 15 of those in revenue cycle. So I do know a few things about revenue cycle. I don't ever like people to be like, what is this lady doing on stage? So thank you to Inovalon for inviting me to share the story of my team. I could not be more proud. So when I think back in my own journey at Phelps Memorial, so I started in 2008. I had been in the clinical world. I started what I call the dark side of healthcare, which is revenue cycle. It's my little joke. You know, nobody likes to be on the dark side of healthcare. But I started as a biller, and we are a critical access hospital. I should probably disclose that as well. We are independently operated. But when I started, I was a biller, and I remember behind my desk, there was this ginormous bookcase of 3 ring binders, and they had our remits in it. So is there anybody that remembers the days of paper remits and having to file? Yes. Okay. Thank you. I'm not alone. I felt like I was going to age myself there for a second. So I vividly remember we were a team of 4 billers, and we had our alphabet by alpha split. So we did commercial, Medicare, Medicaid, we did all of it based on our alpha split. And so the remits would start, this is how the office used to be set up. Renee was over here, and she would start by sorting all of the paper remits that morning, and I'd get my pile for P through Z. And then she would start on the pile that had, different people's alphabet on it, and we'd, station it through. Renee would start, then Shauna, and then I was third. I was supposed to be fourth, but I was third because Melody, bless her heart, she was a very tenured biller, and that's where paper went to die, was on Melody's desk, if you have any of those people on your team. So we always gave Melody the last ones. And then at the end of the week, you'd pile them at your desk, and at the end of the week, you'd spend hours, the 3 ring binders, chronologically filing those for future reference. So we've come a long way, obviously. We partnered in 2017 with Inovalon, and that was just the beginning of our efficiency journey, which you'll hear efficiency come out of my mouth about 9,000 times today. That is my buzzword. That's my passion, is efficiency. So today we are posting at least 90% of our remits electronically. We're scanning minimally. The billers are no longer looking at the remits. Nobody's initialing. The billers these days would not believe me if I told them that I had to do that. And it just goes to show how much we've embraced the change and the wave of efficiency. And I don't have to tell anybody in this room how much healthcare has changed, but the adaptability is what's important, and you have to go with change. So, like I said, Phelps Memorial is an independently operated 25-bed critical access hospital in South Central Nebraska. So Katie and I always joke, it takes me at least 2 flights to get anywhere because I live very rural area. So I am super happy to be here. Because of our financial strength at Phelps, we have been able to expand our specialty services to our community. We have a very direct, a very purposeful idea that we do not want our patients to have to travel. So we pull patients, so we're about an hour from the Kansas border. So we pull patients from Kansas. We're pulling patients from Western Nebraska, Northern Nebraska. We even pull them from eastern Nebraska, where they have Lincoln and Omaha right there. If nobody knows where Holdridge is, but people usually know where Lincoln and Omaha are. So we're even pulling people from those areas. We have a very strong oncology, orthopedic and spine, cardiology program. In the last couple of years, we've opened our own cath lab. We offer over 100 services to our patients, and that is really the driving force behind that, is so that they don't have to travel for their healthcare. Excuse me. And all of that is all great, but what really sets Phelps apart is our people. They are the core of why we do what we do. They are the core of, they come to work every day with the mentality that they want to make that patient who sits across from them, or that patient that they talk on the phone with, the best day that they can have. And also, of course, to capture all of the dollars. So today we're going to highlight my team. So this is Amanda Olson, and Amanda is on the right here, my right. So she is a patient service rep at Phelps Memorial. She has been with our team, with our admissions team, for over 25 years. And you will see that tenure is big at Phelps. The next person I talk about, she's been there 12. It's a very real thing. Jennifer and I, she's the director of RevCycle now. We were talking earlier, we easily have over 100 years of tenure on our revenue cycle team, which is amazing. So 80%, I would venture to say 80, if not more, of the patients that walk through our doors know Amanda. They will call her by name. It was easy when Michelle approached me on who I wanted to recognize. It was easily Amanda. She knows you, you know her, and if she doesn't know you, she's gonna know you. Or she's already made a connection to somebody that she does know and that you know, and you're lifelong friends then after that. I really champion, Amanda is our true champion of AID IT. For those of you that don't know what AID IT is, acknowledge, introduce, duration, explanation, thank you. Amanda does an amazing job. That's how she builds those relationships with those patients. That comes in really handy because Amanda also does all of our financial assistance applications. And so she is talking to those patients. She's building relationships with those. And so she is a trusted person, and she is our front door, our first face of healthcare. So this is where the Inovalon's front end revenue cycle solutions obviously become really integral to our workflows. Early on, this is embarrassing to say, but we weren't doing any eligibility checks. We were just winging it. We didn't know anything. We were just like, yep, yeah, Myrtle's here. She might have Medicare. We don't know. We'll find out on the back end, I guess. There was no visibility. The front desk didn't understand. To tack onto what Shirley and Mario said before, like just that communication and visibility is huge, and you'll hear that throughout my session. But we weren't doing eligibility checks. As you guys can imagine, claims were delayed, if paid at all. Denials were increasingly high. It was frustrating for everyone. The team that knew what was going on at that time, leadership, as you guys can imagine, was incredibly frustrated. Over time, in my leadership, we added manual checks because this was before Inovalon. I didn't have a tool, so I was like, well, let's try this. And we were going to different websites, tracking it on different spreadsheets. It was a nightmare, but it was better than what we were doing. It meant, the teams were going for this website for Medicaid and this for, it was a mess. It slowed Amanda and that team down drastically from spending the time that I wanted them to spend with their patient, with the person sitting across from them, and who probably wasn't having a very great day and didn't really want to answer your Medicare questions one more time. So we partnered with Inovalon with their insurance verification, insurance discovery solutions. What took hours now happened automatically. They no longer chased the data. It was right there at their fingertips. I remember early on in my leadership, another admissions gal came to me and she said, Rachel, I'm really worried about what you're doing. And I said, what do you mean? And she says, well, you're making us too efficient. We don't have the tasks that we had anymore. So, I mean, you're going to have to get rid of some of us. I said, that's never my plan. It's never my plan to get rid of people, of my team. I wanted them to refocus their priority to the patient that's sitting across from them, not on the clicking of the buttons to see if Myrtle had Medicare. I wanted you to have a conversation and ask Myrtle and actually care if Myrtle was having a good day or not. That was my focus. That was my priority. And so after I shared that, I think she felt better. She's still there, so she must have. As you can imagine, the focus on building those meaningful interactions with patients directly impacted our billing, which leads me to introduce you to Maggie Evans. I could go on the rest of the time talking about Maggie, but I will limit it because I do have other slides. But she has been with Phelps for 12 years. Anyone that has met Maggie, interacted with Maggie, knows how valuable she is to Phelps Memorial. And I have vowed if anybody tries to steal her, I will hunt you down. I promise you, I will. So Maggie's story, she would hate for me to tell you all of this, but because she is very humble, but she started working in dietary at Phelps Memorial 12 years ago. And we moved her to admissions because we saw her incredible attention to detail and to processes. And it didn't take me very long to realize she is incredibly talented and she is not in the right position. And so we transitioned her to a billing role, and she was a biller with 3 others at that time for a long time. Early on in my leadership, Maggie and I would sit in my office and we would volley ideas back and forth, and just about the workflows and like where the barriers were and what can we do to knock those barriers down to make you guys more efficient so you're not beating your heads against the wall constantly. She never told me no. Should have. She should have told me no probably a couple of different times, a few more than that actually. But she never said no to a new process. And that openness to shake things up and that dedication to efficiency is really a driving force in Phelps's success. When you pair that with the right tools, it's unstoppable. Your results will just magically appear. So at PMHC, Maggie and her team, they use Inovalon's Claims Management Pro solutions. Early on, we didn't know anything about edits, customizability, nothing. The clearinghouse we used before didn't have that. I had a biller early on. It was Melody, the paper queen. I remember she would put the tax ID number on every single commercial claim before it went out the door. And one day I asked her, I said, Melody, why do you do that? Well, what else am I supposed to do? That's part of my job. And I was like, it doesn't have to be. You can be more efficient. You don't have to, put the tax ID number in that box every single claim. We can automate that. And so she wasn't very happy with me for a long time, but she got there. Lost my spot, sorry. The customizability of the tool, like I've said, has been a game changer. Edits can be implemented as needed. It's given us a more proactive approach rather than reactive. Shirley was talking about our CMI. Our CMI, Maggie is the Shirley at Pam Health. Maggie lives in our CMI. It gives her the ability to, and it's a little bit of a reactive approach, but it allows you to be proactive in the future by putting those edits in place and really getting ahead of where the problems lie. And I'm happy to say that because of the efficiency we've put in place, our relationship with Inovalon, we've been able to decrease our AR from the 80s early on in my career to the 30s and 40s. I'm even more happy to report that we've been able to maintain that standard for at least 5 years, and I expect for us to, as long as my time at Phelps is still there. With those efficiencies, we were able to move Maggie out of that direct billing role into a patient accounting lead position where she oversees the workflows of those teams, works with the billers to identify issues, and just really make us a fine-oiled machine. During my leadership of the rev cycle, the the billers would get frustrated because I, of course, always asking for efficient ways. Where are the problems? What can we do better? And I use the analogy of, a lot of hospitals, unfortunately, like picture it like a bedroom. They have this huge mess in the middle of their room and they can't get out from underneath that mess. They're constantly putting things away and things are being added to that mess and they can't ever get out from underneath that. That was us. That was Phelps. We had a huge mound in our bedroom that we finally cleared. And we didn't have the mess in the middle of the floor anymore. And I said, we have the luxury of being able to pull back the carpet now and look for efficiencies. So once I told them that, they felt a little bit better about things. But of our financial success in the revenue cycle, we have been able to really focus on our patient care and patient-centered care, I should say, because of those strong revenue cycle numbers and giving more time to our team to spend with patients and the resources to serve our patients. It's allowed us to introduce new service lines, bring in those specialists that I mentioned earlier. Patients, like I said, receive care closer to home, which is important to not only them, but us as well. And to me, that's the real power of efficiency and getting your teams to think like that and what the patient is gaining in the long run. It's vital. It creates capacity for growth, better care. Unfortunately, in our area, we saw the need for oncology services, which brings me to Dr. Green and Stacy Van Boning, our APRN. So Stacy joined us about 3 years ago. She works with Dr. Green and Cancer Partners of Nebraska. They're based out of Lincoln, and I'll get to how they get to us here pretty soon. But she's one of our strongest patient advocates. Stacy is in clinic 4 to 5 days a week. She is our boots on the ground. She is available to our patients if they have questions. As you can imagine, when you start a chemo regimen or you have an oncology treatment plan, there's a lot of questions. With visiting specialists, we never wanted our patients to feel like they were just lost at sea without a resource, and that's where Stacy comes in. So Dr. Green, he is one of 5 oncologists that flies to Phelps 6 days a month to care for our patients and their oncology needs. So, which leads me to, I think you maybe caught the word I said, fly. So because of our strong financial responsibility, we own 2 jets. We are looking at buying a 3rd. And that is really because we have such a strong financial viability, and we are focused on bringing the specialists to our organization rather than asking our patients to go someplace else. So we've set it up as a model where we're actively recruiting a dermatologist right now. So, we don't have this little box that we have to stay in with Central Nebraska because ain't nobody moving to Holdridge, Nebraska. I'm going to tell you that right now. It is as rural as it gets. So we've opened up that box and we can recruit. We've talked to a dermatologist from Missouri. We've talked to one from Lincoln. A lot of our specialists come from the Lincoln and Omaha area. We do have specialists that come to us from Colorado, from Steamboat. And it's been a model that has worked well for us financially and for our patients because we're not asking them to drive an hour to 3 hours away to receive their care. We're saying, nope, hold on. We'll bring it here. We got you. So that brings me to Dr. Henry Fabian. So Dr. Henry Fabian started coming to us in 2012. After about 4 years ago, we added Jessica Berquist, his PA. So Jessica, just like Stacy, is his boots on the ground in clinic 4 to 5 days a week. She is a resource to those spine patients. Dr. Fabian is one of 2 that come to Phelps. We also have a strong orthopedic program. We have 2 surgeons that fly into us from Steamboat. They have a boots on the ground. They have a PA named Madison. Those boots on the ground, those mid-levels have been a lifesaver because I had surgery the day after Christmas last year, and I knew Dr. Sauerbrei wasn't going to be there the next day, but I knew I had peace of mind because I knew Madison was. If I had problems, I could call. And granted, I'm probably getting preferential treatment because I'm the chief ancillary officer. I'm not going to lie. But I would say that same treatment goes organizational wide when it comes to our patients. They're available to them whenever they need them. I have a neighbor who has one of our orthopedic nurses' cell phone numbers. And she says, I text Kristen, I was having problems. And I said, great. That's really what the patient-centered care at Phelps is all about. So I remember very early on, I was the patient access coordinator in Dr. Fabian's clinic. And I remember the day he came in and he says, this practice, it's probably going to plateau here in a couple of years. I didn't know anything. He was our first spine surgeon. I said, okay, well, it's 2025 and it still hasn't. He's still very much needed in our community. He, our demographic in Nebraska is very much ag-centered. As you can imagine, there's a lot of farmers who depend on their mobility to continue doing what they love into their 70s, their 80s, their 90s, as long as God lets them. And I really, truly believe that we offer a service to them that they need that is convenient for them. So I love to tell this story. Everybody begs me to tell this story about Dr. Fabian. So he, like I said, started coming to us out of Steamboat. He is nearing retirement. He's done outreach in a number of places, Western Nebraska, obviously having his own practice in Colorado at one time. Dr. Fabian made it very clear to us that we were the last place that he would practice medicine before his retirement. And we didn't believe him for a long time because it's hard. It's hard to put the scalable down, I'm sure. But he has proven that to us. We are the last place that he sees patients. He is nearing retirement. He's moved to Savannah, Georgia. We fly to Savannah to get him because he's that important to us. But that just attests to the culture that we have at Phelps, our patient-centered focus, our financial viability. Dr. Fabian said that that's why he still stays at Phelps. But it really is the culture of compassionate care that is so important to us. It's the teamwork, the dedication, the compassion that we expect from our teams that keeps him coming back. As executives, in orientation, within your first month of employment, you go to orientation at Phelps. And as executives, we stand in front of those team members and we make it very clear what our expectations are of the culture of Phelps. Dedication, teamwork, compassion, delivering that care, that patient-centered care. And we tell them, it's okay if that's not for you. Team Phelps isn't for everyone. And if it isn't, we will promote you to customer and we're all better for it. But it's setting that expectation and holding us to it that I think sets us apart from other critical access hospitals in Nebraska. And it's through the financial viability. It's being able to kind of pull back the curtain, working with Inovalon and really having the transparency of those metrics. Early on in my leadership, I didn't know what AR days were. I didn't know what any of it was. And I remember having a conversation with my CFO, and he said, well, we can get to 55. And I said, okay, I'll take your 55 and I'll lower you. And so I'm thankful that we're there. Tagging on to what Shirley said, Shirley and Mario, about the transparency. I use another analogy because I love analogies, but I had a cousin whose husband ran in the New York City Marathon this last weekend. And I equate a lot of the revenue cycles. If you don't have transparency to the numbers and the metrics to running a race, that you have no idea where the finish line is. So if I asked Jeff, my cousin's husband, hey, could you just go run that marathon? And yeah, where do I end? Well, I don't know. Just keep running. You'll figure it out. That's what I felt like I was asking my teams to do in the beginning before I had the tools from Inovalon to really show them this is where we're going. These are the pit stops along the way. These are the efficiencies we're going to put in place to get there. And I can proudly say that I feel like we've made it, and I feel pretty confident that we'll continue to not only have the financial success, but to be the place, the healthcare center for our patients. So with that, I thank you for your time today and listening to me talk about how great my teams are.